Hey everybody, just wanted to give you another little quick video about another topic that I've been thinking about lately. So definitely in Kapa'a, if you've looked up on my cork boards, and soon in Waimea, I'm going to put up a little piece of paper that is a reminder to ask me to test you for certain infections that can be related to injection use. And so, unfortunately, in my practice, I've already diagnosed several people who did not know they had hepatitis C with hepatitis C. Luckily enough, I have not had any of my patients come up with HIV. All my HIV positive patients knew they had HIV before I saw them. But, you know, there are a few infections that can be related to injections, and this can be either intravenous or subcutaneous or skin popping or IM use or whatever the current phrase is or whatnot. Anytime that a needle breaks the skin, you can either take contaminants that were already on the needle and put them into your body, or you can take contaminants from the skin and get those right into your bloodstream. And usually people are shooting for a vein. And a vein is the blood vessel that goes back to your heart. So you can take those bacteria from your skin and then go back, and they can infect your heart, or they can spread just about anywhere. I've had patients of mine who were injecting their drug of choice, and I've had them have infections from head to toe. So foot infections, brain infections, heart infections, spine infections, other joints on the arms or legs, infections, of course, in the skin, liver infections. Just the bacteria can go just about anywhere. And so, sometimes someone comes in and they're saying they're not feeling well, and it's difficult to tell what's going on. So sometimes we'll draw some blood to see if there's bacteria floating around in the blood, or get an x-ray, or try to figure out what's going on that's causing them to not feel well, and to rule out a infection from injection sources. But also people who have used their drugs by injection should be screened for HIV, hepatitis B and C. And so make sure that the next time you come to the office, if you've ever used a needle to inject a drug in any way, except for one that's, I guess, from the doctor's office or the dentist's office, but one on your own, and you haven't been tested since then, or even if you have, maybe they only tested for HIV and didn't test for hepatitis C. So unless you're absolutely sure that since the last time you've been tested for all of these different infections, let me know, because in the last couple of years there's been a significant change in the medicines that are available to treat hepatitis C. They are very effective, although they're very expensive. They're like $70,000 or $90,000 for a 3-month course. They almost always work, and you can actually get cured of hepatitis C. And they're much more tolerable than the old interferon-based therapies, which would make people who had pre-existing mental health conditions a lot of times get worse. Depression get a lot worse, and they just feel really ill. Generally, these medicines are fairly tolerable. I've had a number of patients just do very well on these new medicines like Harvoni, and there's probably 6 or 7 of them now that are on the market. And also HIV therapy has made a lot of progress now. There's a couple once a day treatments now where it's all combined into one pill, and it's just come just since the time that I got into medical school, years and years ago. HIV therapy has come a long way. So now if you have an infection of one of these things, now's the time to figure it out, because the treatments are much better. So anyway, next time you come into the office, let me know. We'll just send you down to the lab, just make sure that everything's good. And so that's my little update for this week. Thanks so much.